Hello, everyone. My name is Hongtao Yu and from AstraZeneca. And today I'm going to present our research work, mathematical modeling of the physiology of endothelin-1 and its receptors A and B. As introduction, selective endothelin-1 receptor A antagonists have been investigated to treat hypertension and chronic kidney disease. However, their use has been limited because ETA antagonism increases the risk of fluid retention, which can increase the risk of heart failure. Mathematical modeling can be used as a tool to integrate information about complex physiological mechanisms into a quantitative framework. In this study, we have incorporated the physiology of ET1 and its receptors ETA and ETB into our previous developed QSP model of cardiorenal physiology. In this model, ET1 was assumed to be produced primarily in the kidney, converted from big ET, and then circulated to the systemic circulation. A two-compartmental model was designed to describe ET1 kinetics, as you can see from this figure. It is challenging to measure the concentration of ETA and ETB at different locations due to the complexity of organ structures. And according to some literature, we define that the distribution of ET1, ETA, and ETB in the system is that their concentration in the kidney is much greater than that in renal vasculature and greater than the systemic circulation. ET1 is eliminated primarily by irreversible binding to its receptors, and mostly by ETB, and last by ETA. In addition, a nonlinear elimination ET1 was assumed to be triggered when ET1 concentration increased dramatically. Antagonists of ETA or ETB were simulated by directly reducing receptor concentrations in the model, but the PK of the drugs were not modeled. In the results section, 3 clinical studies were used to investigate the mechanism of ET1 and its complex forms, ET1 ETA and ET1 ETB, and their hemodynamic effects on the cardiorenal system. First of all, Kashiger's and Werman studies investigated the renal response to ET1 infusion and ETA antagonists with different dose levels. As you can see, the model is able to describe the time course changes nicely, including the increase in mean arterial pressure and decreases in renal parameters. The ET1 concentration is regulated by the assumptions of the nonlinear elimination mechanism. And here, the effect is balanced to match the concentrations measured in both Kashiger's and Werman studies. Overall, the prediction results can capture the main changes induced by the ETA antagonists and followed by ET1 infusion. Lastly, BOOM study was used to investigate interaction between ET1 ETA and ET1 ETB and their effects on the system. As shown in this figure, the model predictions are in good agreement with the observed changes in renal blood flow and renal vascular resistance across 3 arms. The results indicated that the vasoconstriction effect of ET1 ETA dominates the changes in renal function relative to the vasodilation effect of ET1 and ETB. In summary, this model has the potential to provide insights into the mechanism of selective ET1A antagonist-induced fluid retention. It will be beneficial in exploring the possible combination of ET1A antagonist with diuretic drugs for treating patients with hypertension and CKD. Thank you. Questions are welcome.